Thank you for joining us virtually for a press briefing. My name is Kelly Chandler. I'm the Public Health Division Manager for Itasca County. We're hosting press briefings in Itasca every other Thursday to address COVID-19 related issues and questions. And today we will discuss the state of our local healthcare in Itasca. Our speakers will include Aaron Saudi, CEO of Bigfork Valley, Kelly Skelly, Administrator, Lakewood Surgery Center, Jean McDonald, President and CEO of Grand Itasca Clinic and Hospital, Dr. Dan Suller, Vice President of Medical Affairs and Family Medicine Physician, Grand Itasca Clinic and Hospital, and Dr. Dan Marget, Owner and Governing Board President, Lakewood Surgery Center. Our local Itasca County COVID numbers include 151 newly identified positive cases in the last 7 days, 409 newly identified cases in the past 14 days, and our 14-day case rate per 10,000 persons is at 87.6, and that is as of December 14th. Our numbers have plateaued in December, yet the severity of cases has increased, with 71 Itasca County residents hospitalized, 15 of them in the ICU. And sadly, we have had 30 deaths in Itasca. One remains under review and has not been added to the Minnesota Department of Health database. Our hearts go out to those who have lost loved ones to this disease. On a hopeful note, vaccines for COVID-19 have begun to arrive in Minnesota. And the first vaccines will be delivered to various locations across the state and then redistributed to smaller healthcare entities for administration to our priority groups. Vaccines will be rolling out in phases over the next weeks and months. This will not at all be an overnight process, and we ask our Itasca neighbors to be very patient, to keep using what we know to slow the spread of COVID until we have a majority of our community receiving both doses of the vaccine. COVID-19 vaccination is a two-part series initially. A second dose is given approximately 21 to 28 days following the initial dose. You will need to get the same vaccine the second time as you received the first time, so it is very important that you receive the vaccine from the same location and the same group who administered the first dosage. One frequently asked question that we're receiving is how are groups prioritized? And we do receive that guidance from the Minnesota Department of Health on priority groups, and the CDC also offers some guidance on this. The first grouping will be our hospital workers, specifically emergency rooms, ICUs, other direct care staff. Ambulance staff are included in this first group, and our local hospitals will be vaccinating all of the ambulance crews from our county. Also included in the priority groups are public health staff who will be providing vaccination and working on any testing events coming, and then fire departments and law enforcement officers who are EMS certified, and this is very, very common in rural Minnesota. They are included in the priority groups, and local public health will be vaccinating the fire department, law enforcement, and local public health that are a part of this first priority. The next group is our long-term care staff and residents, skilled nursing facilities specifically. We have 4 of these facilities in Itasca, and all are enrolled in the PPP program, which is actually the Pharmacy Partnership Program. Pharmacy staff will provide these vaccinations for the nursing facilities, both the residents and the staff. If there is a facility that is related or connected to a larger healthcare system, their vaccinations could be administered by that healthcare system. And then following the nursing facilities, we move on to other long-term care facilities such as assisted livings, staff and residents. And there will be a combination of both pharmacies and local public health providing vaccinations for these groups. Following that, there's direct healthcare staff, and that could be home care staff or other clinic hospital staff, persons who have chronic health conditions, mission critical personnel such as law enforcement or fire who were not included in the earlier priority groups, and then also persons who are providing resources to keep our water and our power operational, such as utility companies. Some direct care school staff will be in the next group, other congregate settings, and so on. Please know the priority groups have changed over time. They could very well change again. More information will be coming on who will be vaccinating the priority groups, whether it be local public health, pharmacies, clinics, whether we will be hosting large vaccination events or multiple smaller events. We will be disseminating this information via our written press releases, on social media, specifically Facebook, during these press briefings, in our local and regional newspapers, radio, and television. And then you may always call the Public Health COVID information line at 218-327-6784 for information on the upcoming vaccine priority groups and in which manner they will be vaccinating. And while we're talking about vaccination, it is not too late to receive an influenza vaccination. Influenza peaks at the end of the year and into the new year in northern Minnesota. If you receive the vaccine now, you will still have time to build up antibodies prior to our peak influenza season. And for those who are wondering about taking vaccines close together, 14 days is the recommended time in between having an influenza vaccine administered and the COVID vaccine. I wanted to touch on the most recent executive order 20-103 coming from Governor Walz in Minnesota. There will be continued limitations on bars and restaurants, which will remain closed to indoor seating and dining into January. Outdoor seating is allowed with some capacity limitations. Gyms and fitness studios will reopen with limited capacity. Youth sports may reopen without games or tournaments at this time on January 4th. Social gatherings, both indoors and outdoors, are limited. 2 households indoors with 10 total persons, 3 families outdoors with 15 total persons. And there also will be some changes with schools in January related to elementaries. They will have the ability to open with some additional precautions. This may affect other areas of the state more than us because we do have most elementaries in session. However, more guidance will be coming out on that, and it will be going directly from the Minnesota Department of Education to our school leaders. We want to thank you all for making decisions, really hard decisions each and every day to help slow the spread of COVID, keep it from spreading to our neighbors, our families. Every small decision brings us one step closer to reopening, to getting our sports back, to getting our kids back to school, and our restaurants reopened. Vaccines are coming, yet we still need to keep our good prevention measures of masking, staying home when you're sick, even when you're mildly sick, if you only feel like you have a cold or allergies, staying home if you're waiting for your COVID test result, and avoid gathering in groups. I will now introduce our first speaker, Aaron Saudi, CEO, Bigfork Valley.
Thanks, Kelly. I appreciate the invitation to participate this morning and to provide a brief summary of what's going on at Bigfork Valley. So at Bigfork Valley, we've been treating patients with COVID. However, in the past 2 weeks, we've been fortunate to notice that there's a lower ER volume and decrease in COVID-19 patients needing evaluation or hospitalization. We've recently worked with the Minnesota Department of Health to make modifications to our surge plan to utilize a location in our facility for COVID isolation and potential monoclonal antibody infusions if needed. We currently do have capacity for lateral transfers and swing beds, and we've been working with other facilities within northern Minnesota to try to accommodate however we can. We've been caring for hospitalized COVID patients, but we know we haven't realized the volume that our neighboring facilities have. So that's why we continue to communicate them to collaborate however we can. We have been able to continue our surgical procedures due to our volume. We utilize a committee that meets weekly to prioritize patients and evaluate all of the important stuff like space, staff, and supplies required for any procedure. Our skilled nursing facility has been vigilant at keeping our residents protected from the virus. We're currently testing staff and residents twice a week from MDH guidance due to Itasca County's positivity numbers. This week also, we've had less staff out, which has been nice due to quarantining or testing positive or high-risk exposures. And I'm really proud of how adaptable they've been this year to the constant changes and all of the quarantine and increased workload. we're excited to begin implementing our vaccination plan soon and look forward to that. I also want to take the time to say that I've greatly appreciated how collaborative all of the healthcare organizations in the county and the state have been during the pandemic, and the information that we share together on a regular basis. It's just been wonderful, especially for our independent rural facility. And I hope that collaboration will continue when we eventually emerge from this pandemic as well. It's been good. Thank you.
We will now hear from Kelly Skelly, Administrator, Lakewood Surgery Center.
Good morning. Thanks for having me. I echo what Erin was sharing, that the collaboration that's been shown over the last 9-10 months has just been awesome. I'm very proud to be a part of this community. Lakewood Surgery Center is an ambulatory surgery center, so our patients have their surgery and then go home the same day. And we really have a passion for being able to provide that service for our community. We are open at about 75% capacity. We're 100% staffed. We've been able to maintain our supply of PPE. But most importantly, we want to be a resource to the community, to our local hospitals, should the need arise, and they need to outsource their surgical needs. We want to be available, and we want to work collaboratively with them. So that's kind of our main concern right now, is just to meet that community need.
We'll now turn to Jean McDonald, President and CEO, Grand Itasca Clinic and Hospital.
Good morning. Thanks, Kelly. I'm Jean McDonald, President and CEO here at Grand Itasca, and just want to thank everyone for the opportunity to give an update on what's happening here. We do continue to offer COVID testing for the community, and our criteria really remains the same as the last time we advertised it. You're able to get tested, obviously, if you have symptoms or have had an exposure to COVID. If you are asymptomatic post-exposure, you have to wait the 5 days from the date of exposure to be tested. We're also testing patients prior to surgery, prior to travel, and in several other scenarios. If you have questions about whether or not you meet the criteria for testing, please give a call to our main line and we can help you through that. We've been testing about 88 patients per day on average for the month of December, and that's down a little bit from November. I think on our highest day in November, we tested 178 patients. And so 88 feels much lighter. We have a current positivity rate here at Grand Itasca of somewhere between 18 and 19%. That's been up in the 20, 21, 22% range for the last several weeks. So we're glad to see this coming down a little bit. And as Erin said, you know, we've obviously been experiencing a surge of inpatients. We meet multiple times daily to look at capacity issues at our facility and around the region. The facilities in Duluth do remain full more often than not, and depending on the day, the capacity in the metro looks a little better. There have been some beds available in the metro area for ICU and med-surg. At Grand Itasca, we are on divert or full in our ICU and med-surg floors frequently, but we have felt some improvement in capacity in the last couple of weeks. We're bracing for some post-holiday influx of patients, and of course, nobody has a crystal ball to know exactly what's going to happen and what the holiday, any holiday gatherings could bring. So we remain ready with our surge plan. We are seeing patients in our clinic, in our rapid clinic, and of course, in our emergency room. We do meet daily to look over our surgical schedules, and we have not had to cancel any procedures, but we have paused scheduling additional cases that are elective and require an inpatient bed so that we are sure to have as many inpatient beds available for other patients as we need. And we continue to look at that on a regular basis. We have had to tighten our visitor policy with the recent surge to protect our patients and our staff, and that is always a hard conversation to have with the community when folks have loved ones here and want to come into the facility for a visit. So we'll continue to look at that, of course, as hopefully the numbers continue to improve, and we hope to be able to make some changes to our visitor policy along with that trend line. So I'll turn it back over to Kelly.
Thank you. And we will now introduce Dr. Dan Suller, Vice President of Medical Affairs and Family Medicine Physician, Grand Itasca Clinic and Hospital.
Good morning, Kelly. I appreciate being a part of this panel this morning. So I just wanted to touch on a few items this morning. I want to reiterate the importance of primary care. And the reason being is that, as a family doc, oftentimes we can see patients when issues are just starting out and we can address them and get things turned around quickly. The importance of keeping people out of our emergency rooms and hospitals are just as important now as they have been for the last 9 months. So with all the vaccine planning, that's great, that's very exciting. And I'll speak to that a little bit more in a few minutes. But I just want to put a plug out for continuing the community to receive their primary care, to stay up to date on their chronic medical problems so that we can try to avoid those unnecessary hospitalizations and emergency room visits. I can assure you, I can speak for Grand Itasca and our other surrounding facilities, we are a safe place to come. I continue to have patients that are a little nervous coming to see me, and all the precautions are being taken, and I can assure you that we are following all the guidelines to make sure the visits are safe. I want to touch a little bit about vaccinations. There's a lot of information online, and I can tell you that my smirk on my face is probably giving away, but for the first time in the last 9 to 10 months, I feel like we're finally making some progress towards an end. These vaccines are a new technology, but they've been out for 20, 30 plus years. They've been studied for decades for various other diseases. This pandemic has provided a great opportunity to really capitalize on this new technology. We're able to scale up RNA vaccines much quicker than your typical traditional vaccines, such as flu shots, which is why the various companies in the world have been able to develop millions and millions of doses. The studies out there show that this is very effective and very safe. The initial studies in the United States included 70,000 participants. And since it's been rolling out in the United Kingdom, Canada, and other countries, there's been other thousands more people getting vaccinated. And so I just want to reiterate the fact that these are safe. They are very effective. Getting out of this pandemic is going to require us to achieve herd immunity. And, we can see over the last 9 months that achieving herd immunity through natural infection does not go very well. Sadly, there's been over 300,000 Americans that have lost their lives to this terrible disease. The beauty of the vaccine is we can achieve immunity without risking harm and certainly without risking death. So we're excited. We're anticipating we'll be able to start vaccinating our staff starting next week. And in the next 6 weeks, we'll be able to have our staff at Grand Itasca and others throughout the area fully vaccinated for those that desire vaccination. 90% of our providers at Grand Itasca are desiring to get the vaccine. And so I again, just put that out there to hopefully reassure the public that, we're certainly very confident in the effectiveness and the safety, and hopefully, lending a local voice to that confidence will help some of our community members that may be on the fence whether or not they want to be vaccinated when their time comes over the next few months. I know there's a lot of questions about vaccines, and I don't want to dive into the weeds. I'll end a little early just in case there's some questions from others on the panel that I'd be happy to answer. Thanks, Kelly.
Thank you. And we will now hear from Dr. Dan Marget, owner and governing board president, Lakewood Surgery Center.
Okay, thank you, Kelly, and thank you for letting me be a part of this. I wanted to, again, just thank the regional hospitals and Kelly Chandler and the primary care clinics for really providing that first line of defense. At Lakewood Surgery Center, we specialize in surgical care. And so really, we want to be the second line of defense. We want to back up and support everything that our 3 hospitals in Grand Rapids, Bigfork, and Deer River, we want to back them up and support them 100% in their efforts, support Kelly Chandler and the county's effort, because we know that there's a plan to keep our regional communities safe. But we're here to support them in any way. Early on in meetings, we talked about hypothetical situations where our operating rooms could even be converted into intensive care units if we needed that. Thankfully, we haven't had to go anywhere near that yet, but I just want you to know that we're working with the hospitals and we want to support them in any way we can. Kind of on that same note, moving on to the vaccinations, we're definitely going to follow Kelly Chandler and the hospital's leads on this. We're the second line of defense. We don't expect me and our staff to be getting that first round of vaccinations. Those need to go where they need to go. And I think I learned today on this video conference that emergency room personnel, EMS, ambulance services, the intensive care unit nurses, the people that are definitely frontline need to get those first. So let's let that happen. And then the rest of us will be ready to step in line when it's our turn. I'm real excited to get the senior population vaccinated. I think that's really the priority. So let's get the seniors taken care of and protect our community. So with that, let's just turn it back to the experts here. And Kelly, just thanks again for letting us be a part of this. We want to help any way we can.
Thank you. And we will now move to the question and answer portion of our press briefing. We ask the media to please submit your questions via the chat with your name, the organization you represent, and we will have our panelists answer the questions that are most appropriate for them. We have Kathy from KOZY. How long after vaccinations will students be back to school? That is a great question. I am not sure that anybody on this panel will be able to answer that, as the decisions are really made by our local school districts. Some of it depends on their building capacity. Some of it depends on their staff and how quickly they're able to receive the vaccine. And then are they able to provide appropriate staff for all the services needed for the school? That includes teaching, that includes our special ed, our paras, our bus drivers, our ability to provide meals. So I do not have a great question or answer. I apologize for that. But we will try to keep you informed. Knowing the governor's executive order from yesterday, he did indicate elementaries could return January, I believe it's the 18th. There will be additional safeguards in place. Our local communities have some elementary students back, so it will look a little different for them, but some of the discussions have been around more testing for staff, more PPE. And again, that information will go directly to school administration, but we will try to keep you informed on that, or have our local school administrators provide some press releases on that. Ryan Hoff, KBJR, question for Dr. Dan Suller. Could you please once again lay out the timeline for COVID-19 vaccinations at your hospital?
Yeah, I'd be happy to. So we anticipate next week, Monday morning, we'll be able to start our initial vaccinations for our staff. Over the 3 weeks between next Monday and 3 weeks, we're basically dividing our staff up into thirds, and each week we'll be vaccinating 1/3 of our staff. There's a lot of reasons behind that. One of the things that I want to point out is there is a lot of folks are getting some mild side effects from the vaccine, and we just want to make sure that we don't vaccinate an entire group or department at one time and have a risk of a large group of that singular department being out with symptoms. So the first round of vaccines will be completed in the next 3 weeks. As Kelly had mentioned, this particular vaccine from Pfizer is a 2-dose vaccine. So 3 weeks into January, we'll be getting our second dose. So in summary, 6 weeks from now, we should have our entire staff at Grand Itasca, as well as our local EMS vaccinated. And I know I don't want to speak for Aaron, but the other facilities in the area, are going to be along those similar timelines.
Our next question is from Andy Erickson with the Duluth News Tribune. Where can vaccines be stored in Itasca County? You mentioned public health, clinics, and pharmacies could all be involved in administering the vaccine in the future. Do they have the infrastructure to store the vaccines at the needed temperatures, or will you have to be sure to administer the vaccines before they warm? Any clarification on this would be helpful. I will begin and then allow our administrators or providers to jump in. So yes, public health, clinics, and pharmacies will all be involved in vaccination. Which group is going to cover which priority group is not fully determined. We just have some preliminary guidance on that, and it changes weekly and even daily. So the ultra cold storage vaccine is the Pfizer, and that will be going to, actually some of it has already arrived to various locations throughout the state. It is a hub and spoke model where the facilities that have the ultra cold storage will receive the vaccine, and then they have been determined which groups the vaccine will be redistributed to. And that is happening in our area, and I'll let the clinics touch on how that's working for them. Public health, as of right now, we will not be receiving the ultra cold storage. We will receive the Moderna, which is, it arrives in a freezer, a regular freezer temperature, not an ultra cold storage. And there's certain guidelines for if you start to use the vial, if you put it in the refrigerator to thaw, we have to use it within a certain number of days. And we will be taking special care to make sure that we don't have to get rid of any vaccination because we haven't had it at an appropriate temperature. And I will let the other administrators join in.
Well, I can comment on that as well. We are lucky that we did in fact have an ultra cold freezer for surgical procedures, but from what I'm told, we are a spoke, we're not a hub. And when the hub receives that package and distributes it, we will have a timeline that we're required to use those vaccines. That's why our vaccine coordinator has done a good job of talking with staff, planning those appointments, making sure that when they come for their initial appointment, that they're scheduled for the appointment at the same time 3 weeks later. So there has been a lot of coordination, as I'm sure Grand Itasca can inform you of as well, around all of that.
Yeah, I would agree. Our local hub is Fairview Range, and like Bigfork, we are a spoke, and so we'll be getting our supply from them. They have confirmed that their shipment is on the way, so that's great news. And again, once the ultra cold vaccine is thawed out, we have 5 days to give it, which, you know, adds to the complexity of scheduling all of our employees, and not to mention the holidays over the next few weeks. So it's tricky, but we're excited to do the work.
The other hubs in our area are Essentia, St. Mary's in Duluth, and St. Luke's in Duluth, and they will be redistributing to other healthcare entities. But we do have the local healthcares and the ambulances already planned for with that hub and spoke model. Britta with Herald Review, will there be a cost for a vaccine? The vaccine is administered, the dose itself at no cost. We have been told that we are able to perhaps bill for an administration fee, although we have not personally in public health moved on to what that will look like. It's something we're very familiar with other vaccinations, but there should not be an out-of-pocket cost. And I don't know if anybody else wanted to weigh in on that.
Yeah, I don't have any additional information. Right now, we've just been focused on coordinating employee vaccine. We do realize that we'll have to get involved in education for the community and our employees as well, but haven't really focused on any of that sort of cost for administration yet.
All right, we're down to 2 minutes, and Kathy from KOZY, what is the lowest recommended age for the vaccine? 16. As of right now, it's 16. It's being studied in some younger ages, starting with teens, and then it will move lower than that. But right now, 16. There may be 3 different vaccines. Do they have different criteria? I am aware of 2 vaccines right now, and I can let Dr. Suller weigh in. Right now, the Pfizer and the Moderna are at age 16. There's a little bit different criteria as far as second dose with Pfizer and Moderna, but it's a week, it's 7 days difference, so not significant as far as our planning purposes. Dr. Suller, did you have anything to add to that?
No, I agree. The 2 that are in the pipeline right now are Pfizer, Moderna. One is 21 days after the next, the other is 28 days.
Yep. Yeah, but certainly more to come. I mean, we hear that there's other vaccination companies, pharmaceutical organizations working on this, but as far as details, that is not something we have a significant amount of information on. Just want to remind everybody, we have been talking about vaccines for months and information is coming in quickly. We ask the community for your patience. We will answer your questions as quickly as we can. And I believe I'm speaking on behalf of everyone here on the call today that we will provide as much information as we can and answer your questions, but it will require some patience because the information comes in quickly, and to get it back out takes a little bit of planning. So we appreciate everything you're doing. Please remember, get tested if you've been exposed to COVID. If you have even mild cold-like allergy symptoms, get tested, stay home when you're sick. Don't gather in groups, and thank you so much for all you're doing. Have a great day, everyone.
UPM leads the integration of bio and forest industries. Our constant aim is to produce more with less. That's what Bio4 stands for. Paper is true Bio4 product made of renewable and recyclable raw material. It remains sustainable throughout its whole life cycle. UPM Bio4, beyond fossils.